So welcome back to MLT case study series. So today's case study topic is investigating the mystery of prolonged bleeding, a deep dive into platelet function disorders, unraveling the clues behind increased bleeding time through a clinical lens. So introduction. This case study delves into the complexities of diagnosing and managing platelet function disorders, conditions that disrupt the body's ability to control bleeding. By exploring a real world scenario, we shed light onto the critical role of meticulous diagnostic processes in uncovering the underlying cause of prolonged bleeding time. So, here the objectives of this case study include: the viewers will understand platelet function disorders and their impact on hemostasis, the importance of comprehensive diagnostic approach to identify the root cause of increased bleeding times, and key strategies for managing and treating platelet function disorders to improve patients' outcome. So today's patient is a 30-year-old female with a history of easy bursting and prolonged menstrual bleeding. So this woman having easy bursting, that means skin under the skin the blood is clotting and we can able to see red rashes overall her body, and there is a increased menstrual bleeding in the patients we have been observed. So the initial presentation include: the patient sought medical advice due to recent episode of excessive bleeding following a minor dental surgery. So recently she went for a dental surgery and she got excessive bleeding from her gums, from her teeth. So because of this she approached to the clinic. So there is no significant poor illness, but a family history of bleeding disorders has been noted when we went through the relevant medical history. The clinical presentations include detailed symptom descriptions, recurrent episode of nose bleeding, gum bleeding, and extensive bursting has been seen. So the skin bursting with various stages has been seen in her body. This indicating she is suffering with some internal bleeding disorders or something that are causing her bleeding problems in the body. So upon physical examination findings, multiple ecchymosis or bursts of various ages across limbs and torso has been observed, and no other abnormalities has been found in this patient. So the diagnostic approach, we know that bleeding happens because the problem with platelet. We went with the primary tests ordered include CBC, complete blood count, platelet function test, platelet aggregation test, bleeding time, and coagulation profile has been ordered for this patient. The initial findings include: the CBC looks normal, that means the platelet count is normal, the red blood cell count is normal, white blood cell count is normal, HB is normal, all CBC came normal, but there is a prolonged bleeding time indicating even though platelets are normal, there is an increased bleeding time indicating some problem with her issues. Then when we performed platelet aggregation test, the platelet aggregation test showed an abnormal result indicating potential platelet dysfunction. Even though her platelet count is normal, but there is an increased bleeding time along with the abnormal test in the platelet aggregation test. That means her platelets are not aggregating, her platelets are not clumping properly. This indicating some problem with platelet dysfunction. Then we went further for lab results and interpretation. The detailed results include: visuals of platelet aggregation test results indicate specific abnormalities in the platelet function. That means platelets are not aggregating properly. They are not, clumping properly. That indicates there is a problem with platelet clumping. So the interpretation of this test result include: abnormal platelet function test suggests a disorder affecting platelet aggregation, leading to increased bleeding time. So the differential diagnosis, since the patient having abnormal platelet function, what are the reasons behind this abnormal platelet function? Maybe she might suffering with von Willebrand factor disease, where the absence of von Willebrand factor might increase bleeding time, or she might suffering with Gallman's thrombasthenia. Gallman's thrombasthenia is the absence of GP1B receptor. The receptor, sorry, Gallman's thrombasthenia is the absence of GP2B3A receptor. This receptor is responsible for aggregation of platelets. Absence of this receptor might prone to Gallman's thrombasthenia. Then Bernard-Soulier syndrome. This is an absence of GP1B receptor. This receptor deficiency might cause a Bernard-Soulier syndrome. And acquired platelet function disorders. Acquired platelet function disorders such as usage of medications such as aspirin. Aspirin will block the arachidonic acid synthesis to thromboxane A2, causing the platelet dysfunction. Okay, so based on the reasoning, based on the clinical presentation and initial lab test, these conditions were considered due to their association with bleeding symptoms and bleeding dysfunctions. So the final findings, we went with the genetic testing of the patient to check the presence or absence of the receptor gene that is responsible for Gallman's thrombocythemia is ITGA2B and ITGB3. So the genetic testing shows that there is a problem with her these genes, indicating she might suffering with a Gallman's thrombocythemia. Also, we have parallelly checked the patient's receptor, that is GP2B3A receptor. Even GP2B3A receptor has been identified, has been absent in the flow cytometric analysis of the patient blood sample, indicating she has a problem with GP2B receptor. That means she is suffering with a Gallman's thrombocythemia, that is a platelet functional disorder disease, hence leading to a increased bleeding time. So the explanation, this diagnosis fits best due to specific patterns of platelet aggregation abnormalities and absence of other coagulation defects. So the treatment and management of this patient, management strategies including avoidance of non-steroidal anti-inflammatory drugs. That means these are the drugs that will inhibit the platelet activity. So we should not use these NSAIDs, and use of antifibrinolytic agents should not be, we should use antifibrinolytic agents during bleeding episodes, and platelet transfusions for severe bleeding or surgical procedures can be advocated. The outcome, with appropriate management, the patient experienced a significant reduction in bleeding episodes and improved quality of life. Discussion, the path to understanding managing bleeding disorder starts with recognizing the subtle cues that prompt a deeper investigation. Today's case highlights the indispensable role of thorough diagnostic processes. The value of specialized knowledge. As we've seen, the advancements in medical science offer a hope and solutions, making it essential for healthcare professionals to continually update their knowledge and skills. The power of patient advocacy. This case also reminds us of the importance of patient advocacy in navigating the healthcare challenges, ensuring individuals receiving comprehensive health they deserve. Call to action for healthcare professionals. We encourage you to delve deeper into the study of hematology, to sharpen your diagnostic acumen and advocate your patients with some rigor witnesses. If you are someone who have experiencing unexplained prolonged bleeding, seek medical advice. Your voice is crucial for your healthcare journey. Share this video to spread awareness. You never know whose life might impact with information shared today. Thank you so much.